Now to some listener emails. So we've received a number of emails from our listeners over the past week about the effectiveness of double masking, which is getting more attention in the media and in some cases is being recommended. The first one is from Susan, who writes, "Over the past month or so, I have noticed more public figures wearing double masks. What do you think of double masking? Is it an effective way to increase our protection in light of the variants that we are all concerned about? If you think that double masking is a good idea, can you share any best practices?" And then here's one from Deborah, who asks, "My husband has been doing the weekly early morning outings to the grocery store, and I was suggesting he might want to double mask or use one of our filters with his mask, but he does not think that would be much help and very uncomfortable. He added that if he learned from a credible science source that double masking was advised, he might consider that. Can you give any such recommendation?" So Mike, your thoughts on double masking?
Well, first of all, thanks to Susan and Deborah for these really very good questions and ones that many people are asking in our community right now. But let me take a step back before I address the issue of double masking. Remember, respiratory protection is a gradient. From no protection at all, meaning you do nothing other than just breathe the ambient air around, that swapping the air thing we've talked about, or you have very high level personal protection equipment, such as an N95 respirator, other kinds of devices may even be more protective than that. And then you have everything in between. So staying with the gradient from the highest, we know that the N95 respirator works for two reasons. It's fit and filtration. Remember, we've talked about that so many times, fit and filtration. That very tight face-fitting device does not allow air to leak in and out. And that's why face fitting is important. The material is of a pore size that allows air to come in and out relatively easy compared to what other types of fabrics or barriers might be. But it works because it has an electrostatic charge that traps the virus coming through that pore size that otherwise would just allow it to come right through. So you get to breathe and you still get the protection of not having the virus. So again, fit and filtration applies as we move down to the next level of protection, i.e. medical mask or surgical mask. In that case, it is a combination of how much air is actually filtered through that surgical or medical mask, but also how much is actually leaking in and out of the sides, which is not tight face fitting. And then you get into the situation of the face cloth covering, which can be of any kind of material without any specific design necessarily for the purposes of tight face fit. And of course, then we get into gaiters. Now, if we look at how they each protect us, we have some data that actually one of our team members here extrapolated from studies done by the NIOSH, the National Institutes for Occupation Safety and Health. They're part of CDC. Many of you know that. Dr. William Lindsley, a well-known researcher in this area, actually has done studies looking at the efficacy of face masks for source control of humans' cough and exhaled breath aerosols. And what he found in his work, and then extrapolated upon by our group here, was that if you look at the outward leakage, meaning I've got this device on, I don't want to breathe my virus out into the ambient air, swapping air with others in that case. If I look at the different devices, the N95 respirator, I look at a procedure mask like a surgical mask, a 3-layer cloth face covering, or a 1-layer neck gaiter. This is how much outward leakage you get. With an N95 respirator, 1%. With a procedure mask, you get 52%. With a 3-layer cloth face covering, you get 61%. And with a gaiter, you get 61%. Now that, better than 100% leakage, but you get a sense of the relative issues. If I'm in an area with one of these other devices, I still leak. Now that's better than zero. So that's why I keep coming back to saying continue to wear your mask. If you look at the inward leakage, now I'm worried about, will I be breathing air in that grocery store or wherever? Using the same categories of devices, if you look at the N95 respirator, the leakage in is 1%. If I'm looking at a surgical mask or a medical mask, the leakage is 40%. If I'm looking at a face cloth covering with 3 layers, it's 77%. And I look at a gaiter, it's 59%. So what this also says again is that if I'm in an environment and the infectious dose means I have to breathe the air for 15 or 20 minutes before I have enough virus inhaled into my lungs to make me infected, one of these other devices, other than an N95, surely can give me more time. But it doesn't buy me hours and hours. So we have to keep coming back to the issue, use your mask, and make sure, first of all, it's always over your nose. That's a major challenge where we see sometimes up to 25% of the public wearing something over their face, but it's below their nose. As I've said many times, that's like fixing 3 of the 5 screen doors in your submarine. But when we now get to double masking, you might assume, well, if 1 gives me this level, 2 may give me that level. And you know what? That might be possible. That's why I think people have been confused in saying it's a yes or no issue. It's not. It's a issue that says if I wear a surgical mask or medical mask and I get this kind of protection that I just mentioned, 52% outward leakage, 40% inward leakage, and I now wear some kind of a face covering that basically a cloth of some kind that then holds the surgical mask tighter to my face, I actually get potentially improved protection from that. It doesn't open up more gaps along the side than it was before. The problem with that is, in many cases, the more layers you add, the more the pressure gradient is there to get air through it. So now I have to really suck harder to get the air through, which if you have resistance like that, guess what happens? Air then comes in and out of that leak that occurs at the side of the mask up against your face. Just like in swimming, your goggles, your mask, they don't leak at the glass, they leak at the fit. And so the concern has been just you can't automatically say if you wear a double mask, it's going to protect you more, if in fact you actually make it so that you have more leakage, particularly around the sides. It's not going to leak more across the gradient, you've actually improved that. So this is the challenge we have. There could be 2-layer masks that work better than 1, if in fact you don't greatly impede the air movement through and you don't open up those side leaks. But in many cases, it is just the opposite. So this is where we have to answer the question, is what I'm using better or not? And remember, it's always going to be about face fit and filtration. Now, I expect CDC to be coming out with guidelines, potentially even any day, on this very issue, and I hope that they will address face fit and face filtration. The issue is use a mask of some kind, reduce your time, and remember it is about time. If you're going to be in a public environment, you're going to be in a setting where someone's infected, the dose that you need to get infected will be a function of how much is in the air, how much you filter out or are exposed to because of that respiratory protection device, and time. So I hope this helps explain to you here that, in fact, it could be a positive move and it could be a negative move. But to blanket say double mask for variants is not a responsible answer relative to helping any one of us be better protected. I want everyone to remember that the N95 respirators should be safe for healthcare workers. We still have shortages of them relative to what we need to provide healthcare. So we are, as a country, still yet going to be using these other devices to help protect us. And I hope that over the course of the next days, one of the new major initiatives from this administration is to really take respiratory protection to a new level. We need to find ways to find better devices for the public, for them to use, more like an N95 respirator that's comfortable. If it's not comfortable, people aren't going to use it. That's why also if you add more cloth on, you may actually end up not using it nearly as often because it's just too hard to breathe in. So I hope, Deborah and Susan, that answers your questions. It's really an issue right now of what's tight face fitting, which only you can know, and can you still breathe through the material in such a way that you're going to continue to use the device and you're not going to increase leakage along the sides.